When it comes to opening up the economies, businesses, and schools in the face of the pandemic, the key to clamping down on COVID-19 is testing, testing, and more testing. Hello and welcome to the Unpublished Cafe. I'm Ed Hand. Once again, we're coming to you from a remote location and practicing physical distancing to enhance safety. With more than 80% of COVID cases in Ontario and Quebec, both provinces are having difficulty hitting their testing targets. The heat is rising on both provinces to ramp it up as they slowly start opening up. Coming up on the Unpublished Cafe, we take a look at the need for COVID testing, why it's coming up short in numbers, and what variables may be at play. Later on in the show, we'll chat with Paul A. Baer. He's the Canada Research Chair in Micromolecular Biodiversity, as well as the Director of Center of Biodiversity Genomics at the University of Guelph. He's currently talking with regulatory officials about utilizing his genetic barcoding system to track ecosystem biodiversity, which could hit 50,000 tests a day. As well, we'll chat with Cameron Groom, CEO of Microbix, which is a leading manufacturer of viral and bacterial antigens and reagents for the global diagnostics industry. First, to look at the overall issue of COVID-19 testing, I am pleased to be joined by Dr. Isaac Bogosh, Associate Professor at the University of Toronto in the Department of Medicine, an infectious disease specialist and general internist at the Toronto General Hospital with a focus on tropical diseases. Now, first off, Doctor, the Premier has been calling for more testing and the province keeps falling short. What is keeping people from getting tested or getting enough people getting tested?
Well, yeah, unfortunately, there was a lot of different hurdles. Initially, they just didn't have the capacity to do it. There was, well-known backlogs in the labs. They finally managed to settle that. There were problems with getting the right reagents in the lab. They managed to figure that out. There were problems with limitations or limits, and they didn't have the right swabs or the number of swabs, and a lot of the supply chains were broken. That's sort of been worked out. They had policies in place that said, you can only be tested if you have certain criteria. That's been worked out. So I guess it's the end of May, and it appears that much of this has been ironed out and the testing numbers have gone up. Now, the question is, can we sustain it and perhaps even expand it if need be?
Do you think we do need to expand it?
I think it just needs to be done in a very smart manner and focused manner. And I think I'm obviously very pleased that now no one will ever be turned away from a COVID-19 testing center if they have compatible signs or symptoms or a potential exposure to COVID-19. The policy has changed to allow for that. But again, it's late May, and that should have been the case in early March. Certainly, I think a lot of the capacity can be focused on high-risk settings. So congregate settings like refugee shelters, prisons, long-term care facilities, people who work in, factories where they're elbow to elbow, even with personal protective equipment, like these kind of settings. And certainly, I think diagnostic testing can be expanded to really look for early introduction of this infection because we know it can spread like wildfire in those cases. That's going to be, that would eat up a lot of the diagnostic capacity, the testing capacity. So, there probably is room to expand it, but I don't think it's just a willy-nilly policy like we should say, hey, everyone who wants to get a test should get a test. It's got to be focused. There's got to be a policy and a plan to use it wisely.
So random testing is not really of use?
No, I don't think it really is. I mean, if you do it in a smart manner, it can be helpful. So I know there's a word people get scared of. That word is called surveillance. Whenever you use the word surveillance, people think the government's spying on you. That's not what I'm talking about. I'm talking about surveillance, meaning you will do diagnostic testing in particular environments using smart approaches. And the whole purpose is to find a case in an ocean. And if you find a case, you know that there's also likely a lot of other cases nearby. And then you can hone in like a laser beam and start screening that greater area around that case to see if there's an outbreak. And the whole point of that is to catch these outbreaks early before they spread out of control. And there's a lot of different ways to do it. There's a lot of ways to approach this. There's a whole field of study looking at different surveillance techniques. And there's not one right path. There's a lot of complementary paths. But I think it would be extremely helpful if we want to continue to move forward, if we want to continue to lift these public health restrictions and open up the economy. This is what it's going to take to do it safely, because we won't necessarily have to clamp down again if we can really detect cases and outbreaks very early before they spiral out of control.
I'm wondering the COVID tests that are in Ontario right now, are they all the same? Are they all standard? Or it seems that we've got a lot of people scrambling to make a lot of different COVID tests. And I just wonder if they all have the same accuracy.
They're pretty good. I mean, don't get me wrong. There's no perfect diagnostic test that just doesn't exist. But there are a few different types of test kits that have been licensed for use in Canada. And, there's pros and cons with all of them, but most of them are pretty comparable. The key thing is, do you have the tools to use each test kit? So you might need a special swab, or you might need a special laboratory reagent. So, if the question is, do we need more testing and test kits? Yeah, we could expand our capacity for doing testing and have, a diversity of test kits. I think the other key thing is in the earlier part of the epidemic, and it still might be a problem moving forward, is this reliance on supply chains. And of course, we know that there's tremendous global disruption in supply chains, such that you might not be able to get the right swabs, or you might not be able to import the right chemicals that you need to do the test. So homegrown solutions are ideal as well.
Dr. Isaac Bogosh is joining us in the Unpublished Cafe as we talk COVID-19 testing. He is an associate professor at the University of Toronto, as well as at the Toronto General Hospital. And you mentioned reagents for tests. The entire world is now looking for COVID-19 tests. Is there enough reagents to go around?
I mean, it's tough to know. I certainly, for some tests, yes. For others, no. That it was a hurdle at first. I mean, there certainly were there was a limited amount of these reagents, and that was hampering some of the diagnostic testing that was being done. And it's interesting. I mean, you look at different provinces' policies towards diagnostic testing, because a lot of the provinces, many of us had the same issues, but we all handled it slightly differently. And I think places like British Columbia and Alberta said, you know what, okay, I appreciate that we might not have the capacity to test in the level that we would want, but we're going to use our current capacity to test in the smartest way possible. And they just seem to prioritize their diagnostic testing in a very smart manner. And as they grew capacity, they expanded that in a very smart manner as well. And I think that's obviously the right approach. Ontario is a little slower to do it, but it appears that there is some smart policy forming in terms of now, initially focusing on the hospitals, and then certain narrow restrictions in outpatient settings. Those restrictions have now expanded, so anyone going to an outpatient center will have a diagnostic test. And now I think they're looking and focusing on high-risk environments and high-risk people with high-risk jobs and living in high-risk environments or working in high-risk environments.
Now, working with testing and dealing with COVID-19 hand in hand is contact tracing. And maybe just explain how that works for the audience. And do we have enough of it right now?
I mean, that is such a good point. Thanks for bringing that up. You can have all the diagnostic testing in the world, but if you don't have the contact tracing, what good does it do? They go hand in hand. That's a terrific point. And essentially, here's how things should work. The second the swab leaves a person's nose, the clock should start ticking. Okay? And right off the bat, you need to get that test done quickly. Okay? So the turnaround time should be as quick as possible. And if there's a positive test, that person clearly needs to be notified. And simultaneous to that, that person needs to be contacted by a contact tracer, which is, it's not hard to do. You can train anyone to be a contact tracer. It's just time consuming. And, there's a skill to it, but it's just time consuming. And essentially what they'll do is they'll chat with this person, and they'll discuss, who are your close contacts? Where do you work? Where have you gone? Where have you been in the last couple of weeks? And then the contact tracer will reach out to as many people as possible, or businesses or locations that person said they were in touch with. And they will, they obviously won't disclose the name of the person with a positive COVID test, but they'll let other people know, hey, you were a close contact. Not every contact is a close contact, but they will let the close contacts know that they were a close contact, that they should self-isolate. that they provide education about what COVID-19 is. And I mean, it's extremely important. We know this is a very contagious infection. And if we do the contact tracing in a slow or inefficient manner, which we're doing in many parts of the country, all the diagnostic testing in the world does nothing because, we know that this individual has already spread it to, 2 or 3 other individuals who will transmit it to 2 or 3 other individuals. And you can just see this expand in a rapid manner. This is how we get an outbreak. So by contact tracing, you really facilitate people going into a 14-day period of isolation, and you really help prevent the spread of this infection in community settings.
Dr. Bogosh, thank you so much for joining us.
Anytime. Have a great day.
Dr. Isaac Bogosh is the Associate Professor at the University of Toronto in the Department of Medicine and is an infectious diseases specialist and general internist at the Toronto General Hospital. While Ontario scrambles to boost its testing numbers, a University of Guelph prof is talking to the province about boosting those numbers by 50,000. Paul Hébert is the Canada Research Chair for Molecular Biodiversity and the Director of the Centre of Biodiversity Genomics. And he joins us now. And Paul, the current form of analyzing testing for COVID, is it too time-consuming?
Well, Ed, there are a variety of approaches to testing. Some of them are quite quick. In fact, the fastest method can deliver a result in less than an hour, but they're very low volume. They're 2, 4, 6, 8 samples at a time. And so that's one of the key problems. The fastest methods are low volume, and we really do need to look to a future where we're surveying very large numbers of individuals if we're going to get back into everyday life.
Now, you've developed a genetic barcoding system to track ecosystem biodiversity, and this can really increase the number of tests that could be done. Let's talk about this system first. What does it do, and how can it help?
Yeah, well, I mean, you mentioned that we're biodiversity people, so we have been doing very large volume analyses, millions of samples per year from sites around the world, and it's all based on looking at particular gene regions. So we've adapted that approach to COVID screening, and what it allows us to do is basically survey tens of thousands of samples at a time. So the magic is, there's still the hard work up front to collect the samples, but once the samples have been collected, then we move on to robotic platforms that can handle large numbers of samples and end up pooling large numbers of samples, say 10,000, 20, 30, 40, 50,000 at a time, and tagging the sample from each individual with a little short designator that says, I'm from person 1, 2, 3, and so on. I mix them all up, put them on the sequencer, and then the sequences come out, and we can ascertain the individuals that generate a positive response for the presence of the one particular gene in the COVID-19 genome.
Now,
is that a little too technical?
Well, no, that's pretty good. I'm wondering about the accuracy.
It's wonderfully accurate. In fact, it's based on the same target gene region that is employed in the conventional analyses. So here in Ontario, at least, we're targeting a gene called E, the E gene, which is the envelope gene for the virus. And so it's the same gene region. The conventional tests use the same process as we do, basically, but they're a color assay. They're tracking colors to determine the presence of that gene region, and we are just sequencing the gene region directly.
Paul Hébert is joining us in the Unpublished Cafe. He's the Canada Research Chair for Molecular Biodiversity and the Director of the Centre of Biodiversity Genomics at the University of Guelph. And we talk about this system that you've developed. What would need to be able to, or what needs to be done to utilize that in dealing with testing for COVID-19?
Well, it's pretty much ready to run. It's a bit of a model shift from the current program that's in place in Ontario. Ontario's moved up its an analytical game, but we're still lagging badly behind other nations. I mean, you could go to the United Arab Emirates, for example, and find they've analyzed 5 times more people per capita than we have. Portugal, Spain, places like that. are all well in advance of us, and we're sort of down with Chile and Peru. So we need to ramp up processing radically. And the current facilities in Ontario, we have 25 of them, and they're each analyzing about 500 samples a day, or on a good day, 1,000 samples. And we know that we could analyze 10,000 samples per day. And the kind of place where we see this being applied is potentially, our premier has indicated that he wants to see schools back in operations in the fall, and certainly all the parents and kids do, I'm sure. And we want to, you're going to need to, there are 100,000 teachers in the system. And so that's a massive increase from current sampling capacity. And that's where we see our method could fit in. Sample every teacher in the system every week and survey them for the presence or absence of COVID. You'll have seen just last week that schools in Quebec opened up, and that there were about 40 cases detected in the students and teachers. And they're all mild cases, thankfully. But I think we want to try and get ahead of this and make sure we don't have community spread in the schools. Mm-hmm. And I know parents are going to be very distressed if the school system sort of falls apart this fall if we get a second wave.
Well, why do you think Ontario and Quebec struggled so much with testing?
Well, they're operating in a traditional mode, and we're not in a traditional situation. Mm-hmm. They're dealing mainly, much of the production is done in hospital labs. It's done in what I would describe as an artisanal fashion. I mean, you can make French fries at home in your home fryer, but McCain's and people like that learned that you can automate, you can industrialize that process. Mm-hmm. And that's what's happening now in other places around the world. There are really massive plans for a massive scale up in analysis, but it's not based on artisanal facilities in hospitals. It's based on the implementation of industrial scale facilities. And we think Canada, Ontario, should have one or several of these with the capacity to run hundreds of thousands of samples each week until we're through this. And there will be other benefits because, I think viral screening at large is just something that we should be doing more intensively. We're also, we suffer every year from influenza, and we can do a much better job of controlling those outbreaks if we're just got easy access to really cheap analytical approach.
Paul, I want to thank you for joining us.
Ed, thank you very much for your interest in our work.
Paul Hébert is the Canada Research Chair for Molecular Biodiversity at the University of Guelph. Rapid and aggressive testing for COVID is crucial to opening up the economy. Cameron Groom is the CEO of Microbix, a leading manufacturer of viral and bacterial antigens and reagents for the global diagnostics industry. And he joins us now. And Cameron, from your perspective, what was holding back the testing in Canada?
Well, there are two types of tests, of course, the tests for active virus and for past exposure. And we're talking about the active virus tests. They're based on a technology called RT-PCR, which is generally a very complex procedure. So how many tests you can do is limited by the availability of about 7 components, the swabs for sampling, the inactivation and stabilization media those swabs go into, the availability of lab space, trained technicians, testing instruments, test kits and reagents, and the availability of the testing controls that ensure the quality and accuracy of the whole procedure. And if any one of those 7 components is lacking, your whole system falls down.
Yeah, you mentioned there were 2 types of tests. One for the active virus. The other was for somebody who might be exposed to it.
Correct, and those are the antibody tests that we hear about, and they look for antibodies in your blood to coronavirus that are indicative of past exposure. But the challenge right now with those tests is we can tell you've perhaps been exposed to a coronavirus, but not which one, when you were exposed, or whether you have immunity. So there's a very limited utility to those tests until we know more.
Oh, I see. Now, in terms of the accuracy of those 2 tests, would they be comparable, or would the one that just sort of looks at the whether you were exposed or not, would that be sort of less accurate?
Well, it's a great question, Ed, and it's answering it's a challenge because it's a little bit like how long is a piece of string. When we first started doing the RT-PCR tests using CDC's initial procedure, there were reports that the accuracy of that test, that first iteration of testing, wasn't much better than 50-50. And we've been moving it up towards the goal, of course, to get to 99 or 100%. But it can fall apart on you quite quickly. And the antibody tests, the question is, well, what are you testing for? And you're testing for one protein or proteins on the surface of the virus or peptides, subunits of those proteins. The first question is, well, which one do you want to test for? So your test can run beautifully but be irrelevant. So these are where we get into the deep science of things.
We can talk about tests and testing, but like you can conduct the test, but you still have to get the results verified. And part of the problem I've been hearing is, you get the test done one place and it's got to be shipped somewhere else to be verified. Is that part of the problem? Getting answers quickly? Getting answers quickly. The tests, we're actually been working up something. We run several of these RT-PCR tests for COVID-19 in our labs. And one of the things we wanted to do is actually film the testing and have a narration of that, just to show people how complex it is and how many steps are involved and how it can go wrong. So many of the tests are not fully automated or at best are semi-automated. So there's a lot of manual manipulation of the patient samples that has to happen. And of course, when you put people, new tests in a new location with new technicians, running lots of them under high stress conditions, what could go wrong? Murphy is alive and well. Yeah. Cameron Groom joining us on the Unpublished Cafe. He's the CEO of Microbix as we talk about COVID-19 testing. And we talk about getting those tests verified. Do we have enough facilities for that or I guess enough spread out around as opposed to having to ship these tests all over the place?
Well, there are labs in different, hospital networks and, of course, independent lab chains in different locations in the province. The swabs that you see for patient sampling, the nasopharyngeal swabs or the throat swabs, typically have a snap-off point, and then they actually are put in a vial of media that inactivates and stabilizes the sample, inactivates the virus and stabilizes the sample, and then it can be transported to somewhere where you've got higher throughput testing or better facilities. But of course, you want to give a patient an answer as soon as you can and not have them putting others at risk. So this is part of what you don't want is false negatives, because then people go back out, potentially spread into the community, and you don't want false positives because then you're sidelining, potentially frontline health workers, or alarming communities or extending lockdowns unnecessarily. So this is a big part of what we do is actually creating test controls. These are the patient sample mimics, but they're safe, stable, and consistent, that you can know if you've got a positive control and a negative control. You can ensure that each run of tests you do is actually accurate.
Obviously, COVID is a global phenomenon right now. I'm wondering, in terms of tests, reagents are a key component of that. Do we have enough of that to go around? Well,
there's certainly been shortages of swabs for sampling. There have been shortages of the inactivation and stabilization media and the test kits themselves and the media to run the test kits. Certainly, there's a lot of diagnostic testing that's gone on, but these things have had to be massively scaled for the pandemic. And of course, one of the things that health authorities worry about and should is that nobody's testing for anything else right now. So there are a lot of health conditions we'd normally be testing for infectious diseases that aren't happening. And there are a lot of people that aren't getting vaccinated for the diseases that seem more pedestrian to us now, but are in fact have higher R naught values and can spread wildly if our herd immunity to those drops due to lack of vaccination.
Cameron, I want to thank you for joining us.
My pleasure, Ed. Thank you so much.
Cameron Groom is the CEO of Microbix. When it comes to testing and information in COVID, it seems, well, there's some holes in the story, and it's leading to confusion for Canadians in a time when clarity is key. A new group has sprouted up. It's called the Canadian COVID-19 Accountability Group. Ian Braun is a member, and he joins us now. And Ian, what concerns were you seeing that led to the formation of this group?
Well, there was a couple things. First of all, there was the rather alarming news that came out of the long-term healthcare facilities, and which continues to unfold, of course, tragically. And the other was the expectation that the fire hose of cash that's coming out of government is going to lead to fraud and abuse. We're not so concerned about the small stuff, of course, but when you got $250 billion going out in short order, somebody's going to take advantage of it.
Who makes up this group?
This group came together because the Financial Times had a legal hackathon. And a hackathon is basically just bringing a bunch of people together to solve a specific problem. And a colleague of mine in the UK gave me a call and said, well, would you like to respond to the challenge of how to address these abuses that are inevitably going to come to light in COVID-19? And I said yes, and so I and Alan and a number of others quickly came together. It includes a lawyer in town here called David Yazbek, some whistleblowing advocates at the Center for Free Expression. There's a new whistleblowing group out on the West Coast called Whistleblowing Canada. And we had a journalist and a professor of journalism, Sean Holman from Mount Royal University in Calgary. So it was a pretty diverse group. We tried to make it as multidisciplinary as possible.
Your group is suggesting a federal and provincial ombudsman. What role do you see them playing?
Well, ombudsman, it's a role that's been around for a few hundred years, and they're typically a neutral body that investigates reports of concern from employees and tries to resolve them in the least confrontational way, shall we say, so that they don't get escalated. Mm-hmm. And in this case, what we'd like to see is a COVID-19 ombudsman who can receive reports of concern from Canadians anywhere regarding the COVID-19 situation. So, for example, in these long-term care homes, there have been problems for many years, and whistleblowers have come up and tried to report their concerns. But many times they don't know where to go. So that's where an ombudsman would help. He would take in the complaints. He would direct the people to the right avenue if they didn't know and there was a better avenue. They're also quite good at helping government spot where problems are. So if they're getting a lot of complaints in one area, they might be able to go to the minister involved and say, you better go look at this. And the other thing that they can do is that they can prevent potential whistleblowing situations from escalating too high. Because quite often management will react very defensively, not understanding that a whistleblower is simply trying to fix a problem.
Ian Braun joining us on the Unpublished Cafe. He's a member of the Canadian COVID-19 Accountability Group that was just launched in the last week or so. And, just in the way I read about the Accountability Group, and you're talking about the lack of information, are you suggesting the government's withholding information, or is it just not answering the questions?
It's a little bit of a combination. It's been a long-standing habit of governments to hold information close to their chest. It's a very Canadian thing. The U.S. produces much more data and much greater granularity. So you can see in specific neighborhoods where there are outbreaks, for example, and what groups are most affected, minorities or the elderly. So part of it is an instinctive habit not to release information. But I think there's also, because of this, there's been a failure to develop the capacity to put the information out. And finally, there is a bit of a tendency to want to play it safe with the information. It's almost paternalistic. They're not quite sure what we'll do with that information, so they're holding it back. I also think sometimes they just don't know. They just don't have the capacity to tell us the information we need.
Yeah, that could be. Those numbers are very sizable, that's for sure.
Yeah.
You also are very keen on whistleblower protection, and we talked a bit about that earlier in terms of long-term care homes. In terms of whistleblower protection, are these workers not protected enough as it is?
No. The short answer is no. Okay. There are public sector protections. So if you work in the government in Ontario or the federal government, almost any province except PEI, you'll have legal protections for blowing the whistle. They're weak. There's too many loopholes. But when you get into the private sector, there's really nothing. There are specific acts which might say something like there should be no detrimental action against an employee who speaks up about concerns under this act, say the Environmental Act or the Long-Term Care Act. But they tend to be absolutely useless because they don't have any obligation on the employer to create a system for reporting. They just basically say, you can't do anything. And I am not aware of this ever being used to protect a private sector whistleblower. The odds are just too uneven. You could try, but.
Ian, I want to thank you for joining us.
All right, no problem. Thank you.
Ian Braun is a member of the Canadian COVID-19 Accountability Group. And that leads to our unpublished .vote question. What factors have contributed to the lack of COVID testing in Canada? Mixed messages over who needs it, not enough tests to go around, or the speed in which a test is verified. You can log on and vote right now at unpublished.vote and have your voice heard. I want to thank Dr. Isaac Bogosh from the University of Toronto and Toronto General Hospital, Paul Hébert, Canada Research Chair for Molecular Biodiversity at the University of Guelph, Cameron Groom, the CEO of Microbix, and Ian Braun. He is the spokesperson for the COVID-19 Accountability Group. And I want to thank you for listening to the Unpublished Cafe. Stay safe. I'm Ed Hand.